Hi guys, welcome to my video on common medical school interview questions and hints and tips on how to answer them. So the questions fall under 4 main categories and a 5th one, but only at certain universities, which I'll go into in a little bit more detail later. So the first category will usually be motivation and interest in medicine, and the most common question being, why medicine? So for all these questions, you want your answer to only take 1.5 to 2 minutes. You've got to imagine you're going through a lot of questions in these interviews. And you also really want to stay focused and on point when you're giving the answer. So you probably have loads of reasons why you want to do medicine, but for the interview, only choose 3 or 4. It's similar to what you may have written in your personal statement, but you can be expanding on it a little bit. So you want to link in as much as possible any work experience or personal experiences that have led you to the decision to do medicine, anything you've seen or where you believe it connects with your personality. So a possible example would be, so I've worked with Samaritans. I was talking to a lot of individuals, talking through problems, and I saw the importance of communication. I really want a job where I can use those skills and I'm able to use my empathy for people's situations. However, I also want to do something where there's a practical element to it, like I had when I was doing St. John's Ambulance. You usually then have as a follow-up question, more often than not, why not nursing? So with this, you want to be very careful not to say anything negative about nurses. They're going to be your work colleagues, they're overworked, they're underpaid, and the chances are one of them will be on the panel if you're in a panel-based interview. So you really want to be sure you're aware of the difference between nurses and doctors. So an example answer would be, nurses specialise very early on. They'll either do paediatric nursing or adult nursing and then go into one particular area. With medicine being a doctor, you do a very broad foundation before specialising, so you're able to bring in that knowledge from different areas, because you're going to have patients who have multiple conditions, and you need to know like if medicine's going to interact or not. You might say you want to be the person who makes the final decision, even though nurses do have a certain amount of autonomy to make decisions. The last book really stops with you as a doctor. And you might be interested in doing research. Nurses also do research, but theirs will be more clinically based, and you might say that you're more interested in doing the more theoretical side. So these are possibilities. Another common follow-up question is, what have you done to find out about medicine? Just list like the kind of the basic things you've done, if you've read any books, if you've done any shadowing, work experience, voluntary experience, anything like that. And then just choose 2 or 3. I would personally suggest the work experience and voluntary experience, and then go into a little bit more detail about those and reflect on what you've seen, rather than saying, oh, well, I saw an operation. Be like, no, I learned the importance of communication as part of a multidisciplinary team. I understand the importance of teamwork because I saw this, or the importance of listening because I was able to see this or I did this. It's similar to what you did in the main part of your personal statement. The other very common question is, tell me about your work experience. So once again, it's very similar to what you have in your personal statement. Don't state what you saw, state what you reflected on, what you've learned from the experience. So, when I was volunteering at the local hospital, I had to communicate with patients who had dementia. I saw the importance of being able to change how you talk to certain patients, as well as the importance of teamwork, because I could see how different people work together in a multidisciplinary team to help these patients, everyone from social workers to nurses to doctors to physiotherapists. And the other possible question in this section, I had this in 2 of my 4 interviews, is where can you see yourself 10 years from now? Now for this you follow something called the CAMP structure, which is give a clinical example. So in 10 years' time, I can see myself doing whatever specialty I've decided on after having experience of different specialties. Academic, I hope to be doing research, or I hope at that time I will be teaching junior doctors. Managerial, maybe, for example, saying that you want to be running the trials. And then P for personal, which is just to show that you're aware that you're going to keep a work-life balance. So, hopefully by then I'll have a family, or I'll be keeping on with my hobbies. Anything like that's fine. So the next type of question you get is, why this medical school? So here you need to show that you're aware of what's different about this course, or really just the general outline of it. So do you do dissections or prosections? Does it offer a BSc as part of the degree? Do you get to do an elective? Maybe you have a project where you'll be working with people in other departments, such as nursing students and physio students, anything like that. And you really just kind of want to go through that. Another similar question is what attracts you most to the course and what attracts you least. So most, you'd be looking at the same kind of points. For least, just choose one and choose something you can put a positive spin on. An example of that would be, this uni is quite far away and I'm a little bit worried about that because I've never moved away from home. However, it'll be a great learning experience for me, and I'm hopefully I'll grow as a person. It's one that you probably need to think about before you go in. Just make sure you only choose one, and it is something that it isn't completely negative about the medical school or the university. Also, just as another little add-on to the one before about why here, make sure also that you mention about the university and the city in a positive light as well. Or if it's a campus university, say that you favour a campus university. So the third section is interpersonal skills and insight. So each university will have on their website a list of characteristics they look for in a doctor, and they will ask you questions around this, and to answer them you want to follow the STAR format. So situation, task, action, result, reflection. So basically, what was the situation, what did you do, what was the outcome of it, what did you learn from this? Maybe you learned that you really wanted to work in a job where your communication skills were important. Maybe you learn the importance of listening. So common ones that you get, or at least common style questions, are, give an example of where your communication skills made a difference to the outcome of a situation. So an example of this might be, I saw a very upset patient. I went to ask them if they were okay, what was wrong. They explained their situation to me. Even though I couldn't help, I found that listening really did help them calm down. It made them feel better that they got to get it off their chest, even though I couldn't do anything to resolve their issue. Something along those lines. Another common one is, are you an empathetic person? So with empathy, you need to look at it as an umbrella term. So there's different parts of empathy. So you might give an example of going, yes, and then talk about your listening skills or your ability to understand another person's situation. Once again, following the STAR format. How do you cope with stress? A lot of questions will be in relation to stress. You really want to show that you can keep a work-life balance and that you have coping mechanisms in place. It might be that you do sports, you might do meditation, you might try to keep organised. Organisational skills is quite a common question. It's quite an easy one, that one you really just need to list what you do. I have it in all 4 of my interviews actually, so that is a super common one. Your main strengths and weaknesses. This will be asked in lots of different ways. So they might say, how would your friends describe you? Or what will be on your tombstone? Stuff like that. So you want to choose, once again, 3 or 4 characteristics, ones that you can give examples of where you're showing, maybe you're a really good listener, you have very good leadership skills, anything like that. Trying to really bring it into the characteristics that uni is looking for as well. For your weakness, this is a horrible question and you're pretty much guaranteed to be asked it. You want to choose something you can either put a positive spin on or choose a positive trait and make it out to be a negative. So in my case, I said that I'm a perfectionist. A lot of people say that, but I then broke it down to saying it means that it makes me a little bit slower doing my work because I want it to be the best it can be, and that caused me issues at work. However, I've worked on that now, and I've now got a good balance between quality and productivity, and that's something that I want to keep working on as I move forward. And what are you most proud of? This is a little bit of a trick question because they're going to ask you questions about it. They're really going to go into detail and you have to be able to back it up. So don't lie. Whatever you do, don't lie. I think my example was finishing the half marathon because I have spinal problems and it hurt a lot running. And so they asked me, what did you do to prepare for it? What did you do when you hit that kind of the wall while you're running, stuff like that. So just make sure that you're honest and it's something you feel very comfortable talking about. The fourth section is ethics or critical thinking. So the ethics questions really can be anything. They don't expect you to have really much prior knowledge, except that, you know, stuff that you would have seen on BBC News and that kind of thing. Questions will be, you know, pros and cons of breastfeeding, NHS, should it be privatised or should it still be nationalised, stuff like that. It really can be anything, but the main thing to remember is there's 5 different ethics style questions that will come up, or kind of ethics answers that they'll be looking for. So confidentiality, you'll have questions where it'll be confidentiality based. So patients have the right to have certain things held just between you and them. However, there's some things that you might have to report, and when is it right to, and when is it, you know, should you keep it quiet? Autonomy, patients have the right to decide if they want a treatment or don't want a treatment. We're healthcare managers, we're not in charge of them, we can't make them do anything, but is there a point where, you know, they have too much autonomy, they're asking for something that is just not feasible, it's not affordable, everyone wikis everything these days, and let's say I read an article where this one random treatment got tried on 5 people and they think it might work, and you'd be like, well, it's too expensive essentially, and there isn't enough evidence. So those kind of situations. Justice, justifying really whether a treatment should be used, or if someone should, you know, it might be like you have 2 people and 1 kidney and could go to either of them, they're both matches. Who do you choose? How do you justify your choice, or how do you justify a treatment based on their on its cost? And then there's obviously doing good and not doing harm, which sometimes can contradict with some of the other points. So those are the main things you'll be looking for ethics. You're pretty much guaranteed a question on it though. And the 5th section is quite rare, but it's a weird and wonderful questions. Certain unis are known for it, like Hull York, where it can be anything like, describe the colour pink to a blind person, or you're on a desert island, you can only have 5 objects. What are they? So here it's really showing your imagination, it's really just seeing how you think. I never had any questions really like that, so I can't really help. But I would say if you have, if you're not in the most imaginative of people, like me, you might look at applying for other universities. They are quite plain about it, if they're the sort of uni that asks those sort of questions. But yeah, that's it. I hope that was helpful. There is a book called Med School Interviews, a practical guide to help you get the place at medical school. It's very, very good. It's got an amazing range of questions. You will not get most of them, but it does go into a lot of detail and it gives you loads of examples. Mine were the most common, but they'll have some weird ones that are very rare, but you can never guarantee they won't turn up. But yeah, I think that is absolutely everything. Please give the video a thumbs up if you enjoyed it. Subscribe if you want more videos like this. I am also going to be vlogging as of next week on a weekly basis of my time at medical school, so look forward to that. And leave a comment below if there's anything in particular you want me to do in future videos.